Hey guys, welcome to the respiratory system. I won't say that the respiratory system is the most important system in the body, but it's certainly up there. At all levels of medical training, even basic first aid, the priorities are airway, breathing, circulation. And the respiratory system covers that airway and breathing. Let's start with some objectives for this week's lesson. By the end of this week, you should be able to list and describe all of the organs in the respiratory system and differentiate them between the upper and lower respiratory tract. You should be able to describe the ways that we control our breathing and the role that the respiratory system plays in gas exchange. So the respiratory system can be broken up into two sections, the upper and lower respiratory tracts. The upper respiratory tract would start at your mouth and nose and end at your vocal cords, located at your larynx. And this is where the lower respiratory tract will kick in, and it makes up your windpipe or your trachea, and then the rest of your lungs. In this video, we're going to focus on the upper respiratory tract and its organs and functions. Alright, so starting from the outside, air is pulled in through our mouth or through our nose. Through negative pressure that's caused when our diaphragm contracts. So the diaphragm is a large muscle that separates our thoracic cavity from our abdominal cavity. And when it contracts, it causes our lungs to expand by pulling downwards. This forces us to suck the air into that empty space. When we're breathing normally, it's just our diaphragm that does the work. However, if we get short of breath, either from illness or just increasing activity, we can use other muscles like our intercostals between our ribs, our trapezius, external obliques, or other abdominal muscles to help us breathe. So, air entering the mouth will reach the back of the throat, called the oropharynx, whereas air entering the nose goes through the nasopharynx. The area where they join in the back would be called the pharynx. We'll talk a lot more about the mouth in the digestive system, so for now, let's focus on the nasal passages. So your nose has two nostrils, or nares, which are separated by a piece of cartilage called a septum. Inside the nose are mucous membranes and rows of hairs. The mucus and hairs serve as filters to prevent dust and debris from getting into our lungs. Mucus from chambers around your nose, called sinuses, drain into the nasopharynx, and that also helps with the filtration of air. Inside the nose, there are three bones that divide the nose into these different turbinates, or different levels. This increases the surface area of the mucous membranes and ensures that air passes over them as we inhale. This does two things. First, it allows the air we are inhaling to warm up, which prevents muscle spasms in the lower airway. It also makes it a more comfortable breathing experience. Secondly, it causes that air to absorb moisture or humidify. Again, it prevents our tissues from drying out and makes breathing more comfortable. Alright, so air comes into the body, entering through our nose or our mouth, and then travels through the nasal or oropharynx, and then moving back to the pharynx. Back there is where you'll see a uvula and a bunch of tonsils, which are just groups of lymphatic tissue. At the end of the pharynx, we have two passageways, one for food, called the esophagus, and the other for air, called the larynx. Obviously, we'll go down that passageway, and in our discussion about the digestive system, we'll talk about the esophagus. So the larynx has a few structures inside. It's supposed to allow us to speak, as well as prevent food from accidentally traveling down to the trachea and into the lungs. For the objectives of speaking, we use bands of tissue called vocal cords that can tighten or relax using different muscles. As we exhale, the tightening and relaxing of these vocal cords causes them to vibrate, and that changes the pitch of the noise we're trying to make. To prevent obstructions from entering the trachea, we have a flap of tissue called an epiglottis. So the actual portion where the vocal cords are, that opening is called a glottis. This flap lifts up and down, opening and closing the airway, depending on if we're trying to inhale or swallow, which is why you can't do both at the same time. Go on and give it a try. The epiglottis is connected to a tiny bone in your throat called the hyoid bone, which is a ligament called the hyoid ligament. The larynx as a whole is wrapped in a protective layer of cartilage, which can be easily felt. In males, there's a large bump on that cartilage, and that causes the Adam's apple.